Hi, my name is Greg Fell, I'm Director of Public Health Sheffield. So this is the epidemiology report as of today, the 17th of May. So flat, in a word. The 7-day incidence has been fairly flat for a week and a half now, holding about 50 per 100,000 over 7 days. That indicates that R is about 1, certainly not significantly below 1, not significantly above 1. Test positivity is about 2%, so of 100 people who have symptoms who get a test, 2 of them will test positive, and that's hugely lower than it was a month or so ago. So flat overall, rates are falling really quite steadily and in a long-term way in the elderly, right the way down to people aged 45 or more. Rates are falling there. That's important because that's the group that I'm most worried about in terms of impact. Growing slowly in the 0 to 18s. 2 thoughts: 1, kids are at school and we broadly want kids to be at school, and 2, there's a massive volume of testing going on for school-aged children, and if you look, you find. Probably growing a little bit in 18 to 30. This is a group that's out and about more and are the least vaccinated of the adults. But all up, flat. Lots of talk in my inbox about the Indian variant. Many of you will have seen what's going on in some parts of Greater Manchester. I'm sure that will come to us. It remains to be seen what level it will come to us. We remain ready. We'll be able to respond quickly and appropriately, and we're watching out very, very carefully for that. Some talk about whether or not it's significantly more transmissible. The bottom line is we actually don't know. It's too early to say whether it's more transmissible than the B117 or the Kent variant. Some of it might be about behaviour, some of it might be about biological transmissibility per se. We just don't know, actually. So for now, we keep broadly the same strategy. Hospital activity is really, really low. So still, all up of the 4 government tests, I'm happy that all 4 of them are definitively met in Sheffield. The one that we do need to keep an eye on is the 4th test, variants of concern, changing the risk assessment, but for now we keep the strategy. Hi, my name is Greg Fell, I'm Director of Public Health. So today is the 17th of May, step 3 in the government's roadmap. A number of changes, all of which are included on our website, and the details are at the end. So the key changes: people can meet in groups of up to 30 outdoors. 6 people or 2 households can meet indoors and overnight stays can take place. Up to 30 people at weddings, receptions and other big life events, and no limits on funerals other than the obvious size of venue issues. And you can get a pint inside. And I know many of you have been looking forward to that, as have I. So it's good news for Sheffield, and good news that we're heading in the right direction. The key to successful continued progress is vaccination. If you are offered the vaccine, it's really, really important that you take that offer up. The basic fundamentals haven't shifted, so we're going to keep going, and let's take this next step forward safely. So although you can meet indoors, it's still safer to meet outdoors as and where you can. If indoors, let fresh air in, open the windows, open the doors. Summer's here and it's a bit warmer than it was, so let the air circulate. New guidance on close contact, the hugging guidance. I'm not going to tell people what safe hugging is. It's up to you who you choose to hug or not. Consider perhaps whether or not people have been vaccinated and or whether or not they're vulnerable. Social distancing and face covering should continue in shops and on public transport for a while. The basics still matter. Washing hands, keeping distance, face covering, ventilation, all of those things have and continue to make a big difference. Stick to the programme, and we'll keep Sheffield open. Hi, my name is Greg Fell, I'm Director of Public Health at Sheffield. So this is a vaccination update of the 17th of May. So the vaccination programme all up continues very successfully, and as a city we plan to vaccinate the whole adult population with the first dose from 31st of July. As of today, 285,000 people in Sheffield have had dose 1, 141,000 people have had dose 1 and dose 2. Coverage is really, really high, well over 85-90% from people aged 50 or more. However, that's still about 10% who haven't been vaccinated, so we're focusing quite hard in that space. So the Joint Committee on Vaccination and Immunisation issued some advice just before the weekend, and we're aiming to accelerate the remaining second doses for over 50s and those who are clinically vulnerable, so to make sure that we've got the maximum protection for those who are most likely to be impacted. So if you're in that group, the NHS will be in touch with you fairly shortly, and it's really important that you do get your second dose. We will also prioritise first doses for anyone eligible who hasn't yet come forward, particularly those over 40, and would encourage you to come forward as soon as you can. There are concerns about the Indian variant or the B.1.617.2 spreading across the country. All of the indications are that the vaccine works against that variant of the virus. Thus it remains really important that you protect yourself and others to keep Sheffield open and to keep the freedoms that we've just got back as of today. So if we want the pandemic to end and life to return to normal, people will need to get a vaccine, and it's one of the key routes out of the pandemic. And we'll also need to follow the government guidance on social distancing, face covering and washing hands. Vaccination per se isn't a complete pass out, but it's a really, really important step. So younger people may feel that they don't need to have the vaccine, they're less likely to be seriously ill. However, still plenty will end up hospitalised and or developing long COVID, and the reduction in transmission helps us all keep Sheffield open. So please, if you're eligible and you're invited, please book and get your vaccine as soon as you can.